What you're looking at, tooth number 8, is right here. This is the one that's going to be removed, and she's had root canal in that tooth, which you can see the root canal filling here, and then they put a post into the tooth that they could build the crown around a post. They do what's called the root canal, and then they do a post and core, and the post goes into the root canal space, and then a restoration called a core buildup is made on top of the post. The core buildup is then prepared, impressed, and then the porcelain crown is fabricated from that. So that's what we're looking at. The problem is that quite frequently with root canal treated, post and core treated teeth, the tooth gets very brittle and the tooth cracks, which is basically what's happened in this case here. Typically, if we remove a tooth, then you need about 3 to 4 months of bony healing prior to placement of the dental implant. However, if the root structure and the location in the mouth is amendable to removing the tooth and placing the dental implant immediately, then we try to do that because it saves the patient a ton of time. So one of the most critical things in doing an immediate implant upon extraction of a tooth is to remove the tooth or extract the tooth in a very atraumatic fashion. There are different techniques which are used. You can use different instruments to get around the tooth and to get it extracted in an atraumatic fashion. So, when we're performing an immediate implant, you can see how we've got a distoangulation on the root of the tooth. I don't want to put my implant in that angulation. I want to keep my implant in the angulation that is more parallel with tooth number 9. That's right there. Another thing we do is we use things called directional indicators that can go into the osteotomy site and show me the position where my implant is going to be. And what I would ask you to do, the post sticks beyond the teeth, so when you close down, you're probably going to touch the post. But I do want you to bite together. Easy, easy. Bite on your back teeth. On your back. Yeah, there we go. That's what I wanted. And her occlusion is perfect for this. We are almost done, my dear.
Okay.
Coming down the home stretch. You have to be very careful these days because there are a number of general dentists who are dabbling in dental implantology, which in my opinion is a very bad thing. We here at my office typically will place 500 to 600 dental implants in a year. I think yesterday we did 9, I believe. Mm-hmm. Today we were supposed to do 3. You were the 3rd, but my patient, one of my patients, a physician, works in Atlanta. Mm-hmm. And she comes home on the weekends to stay with her, she is a research scientist, to stay with her family. And Atlanta Airport wouldn't, they wouldn't fly out of the monsoon or fly into the monsoon, I don't know. So she told me last night she canceled. So my point being, is that you want to see a qualified person to place your dental implants. You don't want to go to a general dentist who has maybe placed 10 implants in their whole career because they've taken a class on the weekend, continuing education class. So be very selective. All right, dear, here we go. Right at the base of the osteotomy. Create very slow placement of the implant. Real tight. Good. And I want you to gently close. Stop, open please. Great, beautiful. So the implant is titanium, 100% titanium, and they acid etch the titanium. So it's very rough on the outside, and that allows the bone cells, as we've talked about, the osteoprogenitor cells, we're going to make bones, they have a nice rough surface that they can bond to and create bone along the surface of the implant. The implant is also hollow and is threaded from the inside. Her general dentist will screw an abutment into the internal threads of the implant. So what I've done is I've taken some of her bone and mixed it with some of the cadaveric bone. Yeah, I'm just going to do. No, we'll use all of this, and then if there's any left over, I want as many bone cells as I can get against the labial aspect. Nice. Now what I'll do is just gentle pressure. Again, I don't want to disrupt the location or the position that we worked so hard to attain. The suture that we're using is all resorbable suture. This in particular is a 4-0 chromic gut suture, and it's a relatively thin suture with respect to oral surgeons. A lot of oral surgeons you'll find will use 3-0s, but this is a little thinner, and it's easier to manage. Patients tolerate it much better, and it's less irritating. Comes out sooner. Okay, so what we have here is we have the 12 millimeter Straumann ITI bone level implant placed in the osteotomy site. As you remember from the original X-ray, the other tooth root was almost touching the two roots were almost touching. So we moved it over a little bit. It got much more parallel with tooth number 9, and as you can see, got good mechanical locking in the bone high in the osteotomy site. But as we move down, here is where the shape of the root of the tooth leaves a little bit of a void. But this is where here, this lighter looking bone, this is all bone up here, but the lighter bone is the bone that we packed in there. And then we sutured it closed, so you really can't see the gum tissue here, but the gum tissue is sutured over top. So what you have there is a beautiful dental implant, and one that, given time to osseointegrate and restore, should be a lifelong restoration.